Hi, welcome to the second lesson of our module. Last time we discussed how to properly start a consultation. So you've greeted the patient, made them feel comfortable, and created a trusting atmosphere. What comes next? I'll be speaking from the perspective of a dentist, since that's my profession, and I'll be sharing examples from my own practice. You can adapt this to your own field, taking into account the specifics of your particular area in medicine. So, next up is gathering information. Ask the patient the main question. Tell me what brought you here. Try to avoid phrases like, "What are you complaining about?" or "What is bothering you?" These can make the patient uncomfortable, especially if they didn't come with specific complaints, but for example were referred by another doctor. Also clarify whether they have already seen a dentist and if they are informed about the condition of their oral cavity. The patient's experience is very important. Give them time, at least a minute, to share everything that concerns them and don't interrupt. Use active listening techniques. Maintain eye contact. Nod your head to show that you are listening. Use supportive words. "I see," "Yes," "Tell me more about that." Summarize what the patient has said. For example, "So, you are concerned about pain in your tooth when chewing, and you want to understand how this can be fixed. Is there anything else?" For children, especially if they have never been to the dentist before, it is both possible and necessary to explain what you do. The main thing is not to use complicated terms and to simplify. For example, "I can make your teeth straight so your smile looks beautiful." "I can make it so this tooth doesn't hurt or bother you anymore." As I mentioned in the previous lesson, according to research, doctors often interrupt their patients. Only 20% of patients manage to say everything that is bothering them. And if the main reasons for the visit are not identified, the consultation becomes ineffective, as does, of course, the subsequent treatment. Not to mention, the patient might leave dissatisfied and choose another specialist instead. To avoid these mistakes, it's important to ask open-ended questions and give the patient a chance to speak. According to studies that analyzed 2,000 consultations, doctors mostly ask closed-ended questions. But what exactly are open and closed questions, and how do they differ? An open-ended question implies a detailed answer. They usually start with words like what, why, for what purpose, or how. Here are some examples of such questions you can ask a patient. What would you like to discuss today? How can I help you? A closed-ended question, on the other hand, expects a straightforward answer, a simple yes or no, a specific date, and so on. For example, if you ask a patient, "Were you born in 2005?" they can only answer yes or no. Of course, closed-ended questions are also important, but they don't help you build a trusting relationship with patients, understand their concerns, or accordingly, create a treatment plan. Open-ended questions allow the patient to feel that their story truly matters. When a person realizes they are being listened to, they begin to trust you. And this is a key factor in building long-term relationships between doctor and patient. Open-ended questions also help uncover hidden issues that the patient might otherwise keep silent about. For example, when asked, "What brings you here?" a patient may talk not only about the toothache, but also about other concerns, such as financial limitations or other factors that could affect the treatment plan. You can pick up on some of their answers to show that you are also just a regular person and open to dialogue. For example, if a patient says they grew up in Novosibirsk, you might respond, "Really? I was just there recently on vacation with my wife. We really enjoyed it." This helps create a more pleasant atmosphere and brings you closer to the patient, allowing you to get to know them better. But you shouldn't overdo it or lie, because patients can always sense that. Your comments should be natural and organic. Find your own style of communication and approach these questions in the way you think is best. There is another important aspect of gathering information, that is nonverbal communication. Pay attention to the patient's condition, their facial expressions, and their gaze. Perhaps they are nervous or not telling you everything. In such a case, you can gently ask, "I noticed that you seem a bit uncomfortable. Would you like to talk about it?" This will show that you truly care about the patient's well-being and that they are not just another entry in your work schedule. In addition, it is important to take into account the cultural and social characteristics of your patients. The ability to adapt your communication style to each individual, in my opinion, is a sign of true professionalism. Another important technique is to use the patient's own language. If they describe their pain as aching or shooting, use those same words when clarifying. You mentioned that the pain is aching. Is it constant or does it only occur under certain conditions? This not only helps to better understand the symptoms, but also builds trust as the patient sees that you are listening carefully. Don't forget about the emotional aspect as well. Many patients come to their appointments feeling stressed, especially if they have already had a negative treatment experience. Try not to use trigger words that provoke negative emotions, such as pain, injection, or surgery. Don't be afraid. It's important not only to gather information, but also to help reduce tension a little. It's also important to understand that gathering information isn't just about complaints. Find out from the patient how they take care of their teeth, whether they have any bad habits, such as smoking or frequent consumption of sweets. Pay attention to which medications they are taking, as indicated in the health questionnaire. All of this can affect the condition of the oral cavity and the choice of treatment method. After the patient has finished speaking, don't rush to move straight to the examination. Summarize. You told me about the tooth pain and sensitivity to cold. Is there anything else you would like to discuss or that I should pay attention to? Sometimes the most important details come up at this very moment. Think of this stage of the consultation as a puzzle. The more details you gather, the clearer the picture will be. That's why it's important to be attentive and meticulous. Don't forget to take notes or have your assistant do it. If you don't have a special form, use a regular sheet of paper. By using the tips from this lesson, you can structure your work and achieve better results. Remember, an effective consultation is not just an exchange of information, but an opportunity to understand the patient and make them feel heard and understood. After all, the patient is entrusting you with their most valuable asset, their health. And your task is to live up to that trust. Keep sharpening your mind and see you soon.